next on When Technology Meets Healthcare, Examining Hindrances to Patient Care During COVID-19. PICC's Community Advisory Board, or our CAB, is grounded in the belief that everyone brings expertise to contraceptive care and that diverse expertise is required for PICC to succeed. The CAB is comprised of 22 consumers of contraceptive care and community stakeholders throughout the state of Massachusetts. Today we have 3 CAB members representing the group. The first member is Jay Carroll, who is a family law attorney and director of the Legal Advocacy Program at a local domestic violence organization. Jay identifies as a white, queer, non-binary, trans solo parent by choice. Jay strongly believes that reproductive justice and family planning is not just about choices surrounding having children, it's also about access to the resources to safely parent the children you do have. Jay brings experience advocating for trans and non-binary folks to be included in research and conversations regarding contraception, pregnancy, birthing, and parenting. We also have Joanne Thaluzma, with us today. Joanne is a doula, childbirth educator, and maternal mental health advocate. She is the owner and founder of Isla Birth Village, a Boston-based private doula practice. Since 2019, she has attended over 30 births at hospitals, birth centers, and homes. Joanne is passionate about birth options advocacy, eliminating pregnancy-related racial and ethnic disparities, and reducing traumatic maternal and infant birth outcomes. A strong supporter of community building and outreach, Joanne is a Reaching Our Sisters Everywhere, or ROSE, community transformer and volunteer breastfeeding peer counselor. Finally, we have Angelique Bouthot with us. Angelique is a graduate fellow at Merrimack College, pursuing a master's in education and community engagement. Her prior work focused on sexual health, community outreach, college health promotion, and customer service. Most recently, she was the community outreach manager at Planned Parenthood League of Massachusetts, where she encouraged community members to ask questions, share information, and exercise their right to high-quality, inclusive sexual and reproductive health care and education. Thank you so much for being here, you 3.
Thank you so much. Good morning, everyone, and welcome. Thank you so much for joining us at PICC's annual meeting. My name is Joanne Thaluzma, and I'm so honored to be here with you this morning, representing PICC's Community Advisory Board with my fellow members, Angelique and Jay. So let's jump right into our presentation, When Technology Meets Healthcare, Examining Hindrances to Patient Care During COVID-19. The learning objectives for this presentation are the following: to understand the role of PICC and the CAB in expanding access to contraceptive care in Massachusetts, to describe the need for high quality patient care virtually and in person during COVID-19 and beyond, to discuss patient experiences with telehealth, as well as to recognize where inequities may impact the telehealth experience and reduce patient health outcomes. Next slide, please. I'd like to share with you our mission statement. The Partners in Contraceptive Choice and Knowledge Community Advisory Board strengthens the program's activities by providing guidance to the core team, proposing innovative avenues for addressing gaps in contraceptive care and access, ensuring sustainability, and amplifying the diverse voices of Massachusetts residents receiving such care. Our ultimate mission is to reduce health inequities and promote reproductive justice in Massachusetts. Next slide, please. Next, I'd like to tell you a bit about the Community Advisory Board and our incredible members. The members of the Community Advisory Board, also affectionately known as the CAB, range in age from 23 to 58, and we represent diverse racial, cultural, gender, and socioeconomic backgrounds. CAB members hail from many different parts of Massachusetts, including, but certainly not limited to, Boston, Cambridge, Lynn, Millbury, Salem, and Worcester. Most of us have received care in some capacity from area hospitals in Boston, Brockton, Winchester, and other neighboring cities. Among us, we have students, community workers, birth workers, attorneys, and educators. We share a collective commitment for reproductive justice and contraceptive freedom. Our accomplishments include a contraception decision aid, which is not yet in circulation, but will be soon, as well as a complimentary media inclusivity consultation service for local medical settings that really aims to address the need for materials that are easy to navigate, welcoming, and inclusive to all genders, people of all sizes, people of all literacy levels, and in multiple languages. This service is really intended to ensure that materials in medical settings, everything from pamphlets to intake forms, are accessible for all patients regardless of their backgrounds. And finally, within the CAB, we have discussions about topics that affect our communities. For example, most recently, we have been discussing COVID-19 and how patients can access care during a time when we're encouraging social distancing and staying at home as much as possible. This shift in how we interact has led us to transitioning to virtual connections in lieu of face-to-face appointments. Which really brings us to our next topic, telehealth and COVID-19. Telehealth has been used in some capacity over the last 2 decades, but it has become an increasingly appealing option for care providers who see patients today. It is also true that telehealth has become an increasingly appealing option for patients who, for a variety of reasons, cannot attend traditional in-person visits at hospitals, medical centers, and medical offices. Given increased access to high-speed internet, smartphones, and computers, it really is unsurprising that care providers are leaning into these advances to perform telehealth visits. This innovative way to provide care means that for some, getting quality medical care is simply a video call away via Zoom, Skype, FaceTime, GoToMeeting, and other numerous video conference applications. Next slide, please. Simply put, telehealth allows patients to access care from the comfort of their homes and in their pajamas when they need it most. Never has it been so easy to access our care providers using technology. Many of us experienced disruption to our care this past spring and summer when COVID resulted in the closure of medical offices. Unless you were medical personnel, an essential worker, or a patient who required emergency care services, your care provider was simply not able to see you in person. As the nation grappled with the pandemic, our medical appointments were canceled, rescheduled, or postponed until late 2020, and in some really frustrating cases, early 2021. Thus, this has really ushered in a renewed focus on telehealth. Next slide, please. The CAB realized through our own personal and professional experiences that disruption to access to care and contraception could have troubling consequences, exacerbating health inequities. For many of us in the communities we interact with regularly, COVID-19 and the transition to remote medical care has not been without its bumps. Accordingly, in this new normal, now is the time to really evaluate the benefits and risks of telehealth. Next slide, please. It really goes without saying that the benefits of telehealth are innumerable, but it might be helpful to spell them out here for the sake of our presentation. Telehealth allows for unrestricted access to care providers, including specialists who may not be nearby, to maintain continuity of care. For many patients, there can be a wait to see a specialist if the patients have to consider their personal work schedules as well as personal obligations to their families. The specialist they need to see may be in the next town or even several cities over. Accordingly, telehealth allows for more flexibility in that regard. Telehealth also allows for increased access for patients without reliable transportation. Within Massachusetts, public transportation schedules were disrupted to minimize individual as well as group exposure to COVID-19, as well as to adjust to an increasing number of employees working from home. For patients who had to travel to an appointment and did not have access to a vehicle, telehealth has really allowed them to receive timely medical care at home. Telehealth also allows for the increased access for patients without reliable child or elder care. Let's face it, most of us are living in multi-generational households right now. So we're not only considering the children that we're raising, we're also considering our parents and other older relatives like grandparents. So telehealth really allows caregivers to see a provider without also having to coordinate care for loved ones. Telehealth allows for increased access for patients with limited mobility. Those with limited mobility may lack reliable transportation. They may not have access to their own vehicles or even a rideshare option like Uber or Lyft. If they rely on a caregiver, they have to consider their caregiver's availability for any in-person appointments. So if their caregiver has to work or if their caregiver isn't feeling well, they may not be able to help them get to the appointments that they need. So with telehealth, patients with limited mobility can certainly see their providers with ease. Telehealth also allows for the reduced likelihood of COVID-19 exposure in medical facilities. Let's be honest, especially nowadays when most of us go to the doctor, it's because we're simply not feeling well. And while most offices are strictly enforcing social distancing and providing PPE as needed, you are still at increased risk of exposure to infectious diseases when going to your doctor's office. We are certainly heading into cold and flu season, and now we have COVID-19 to consider as well. So telehealth helps reduce our risk of exposure and poor health outcomes by minimizing the time we spend in medical facilities. And finally, telehealth really allows for the reduction of sick time usage because patients can speak to providers during breaks. So if they have a 15-minute break in the morning or afternoon, or if they'd like to use their lunch break to talk to their care provider, they can now do so with ease. This is particularly important for patients who do not have access to unlimited sick time through their employer. So I've talked quite a bit about the benefits of telehealth, but what about the challenges? The CAB's conversations have led to the unveiling of pain points for those who are accessing telehealth, such as the challenges that threaten the confidentiality of patients, as well as widen social, racial, and ethnic group inequities. It is vital that we discuss the other side of telehealth and how this can impact patient care throughout the country.
Awesome. Thank you so much, Joe. I think it's so important that we focus on all of those incredible benefits. But when we were having CAB conversations, we often ended up, evolving the conversation into these what ifs or these particular situations where, maybe every little thing happened to turn into something larger and a bigger challenge and barrier to care than folks initially anticipated. So I'm going to spend a little bit of time talking about some of the telehealth focused challenges, so things around patient concerns and delivery of care, and then Jay's going to hop into discussing specific identity-based experiences. So first, looking at patient concerns. So what are patients worried about when they hear that their next appointment is going to be via telehealth versus in person like they may be used to? And the first one that we would hear, and the one that we were hearing again and again, was a distrust of quality. So people are concerned, is care over a screen really as good as it is in person? Is there something that is being missed if someone is not in person? This came up pretty frequently, and people also shared that this opinion may differ depending on the type of care that someone is accessing. Another issue that came up was confidentiality. I know Dr. Castagno mentioned this in her presentation earlier, right? But is this really secure? So people were concerned on, is their information going to be, accessible to people other than their care provider? We often hear for community education spaces or meeting spaces about Zoom bombing, but I think that was something that a few people were worried about, like, well, is someone else going to be able to see my care appointment, or will someone else be watching, or something like that? Something that also came up again and again was private space. And this will come up a lot more in Jay's discussion after, but privacy might not always be available to people in their home. So for some people, telehealth may allow more privacy, and for other people, it may decrease privacy. So people may not be able to separate from their family or their children or their roommates in order to have what's really a private conversation. And then there's also some current concerns around the method of delivery. So is video needed for the call? Can the visit be completed via telephone as opposed to video, excuse me. There's also the option of access to email or text support for questions to be asked privately. So again, if someone is concerned about private space, maybe they can be on a video and talk about birth control, but maybe they have another concern or question that they can't ask out loud. Is there a chat function that can be utilized during the care appointment so they can make sure that those questions are being asked? Another issue that Dr. Castagno mentioned earlier was the digital divide, right? So lack of technology. So is there reliable access to computers or phones or reliable internet? And we also know that in some cases, those are not evenly distributed according to race, socioeconomic status, and gender. I was, however, very encouraged by some of the data she shared earlier. And then there's also tech issues at the time of appointment, right? So these are the at the moment, internet goes down, computer gets unplugged, someone accidentally hits the wrong button and exits out of a meeting, you know, all of these different things that can happen at the moment. Who is going to call back? Will they get a telephone call if they get disconnected? Will they get an email? Do they just hop back into the link? Is the link no longer working because it's only one-time access, right? So there's all of these other aspects that can impact the actual care appointment. And what I would love to say is that was me this morning when my laptop decided it wasn't going to work. So I am rocking a very old ancient laptop right now because it was a last minute, oh no. You know, patients are also doing that of planning to have an appointment on their laptop and then ending up on a phone. So we also have some particular concerns that come up related to types of care. So here we go. So issues with care. So some things that come up a little bit more on the provider side of things, staff training and morale, or sort of staff experience, came up a few times in our advisory board conversations. So as Joe mentioned, telehealth has been around for a while, but it hasn't been widely utilized. So some providers had a lot of telehealth experience before this pandemic. They were confident in continuing to provide care in this way, but many did not. And that sometimes is apparent to patients, right? So this has improved over time, but at the beginning, practices were really leveraging all of their resources to quickly make decisions, craft new workflows, cascade information. Some were troubleshooting multiple platforms. Now they were supporting staff working from home that have never worked from home before, rolling out new technology, and practicing in an entirely new format while doing their very best to maintain high quality care, right? So folks often would share that they had great experiences with providers saying, you know, oh, you know, we're trying and learning, we're doing our very best. And then there were also some experiences where maybe a provider or support staff were unsure of a new workflow or, you know, not positive on the best course forward when navigating new technology. So it's understandably overwhelming, but it can be felt by patients and it can impact the experience. So things like wait times or confusing messages. This one came up a couple times of people getting messages like, oh, we'll see you in the office next week, where they were automated messages, right, that would confirm appointments. But they actually weren't going to be seen in an office next week. They were going to be seen via telehealth. So just making sure that some of those processes are updated along the way. Another piece that I want to thank Joe for highlighting, especially, a number of our CAB members are birth workers. And this was a big concern that came up. So much of our work is focused on contraceptive care, but this really impacted the birth experience for people here in Massachusetts and across the country. So they've shared that the elimination of choice that's occurred with limiting visitors or the number of people attending births has on their clients and patients. So birth workers may be considered a visitor by hospital rules, but birthing parents consider them a critical part of their birth team. So choosing between a birth worker and a partner or family member may mean receiving doula support via video in the hospital instead of having that person in the exam room with them. Another issue with care is not all types of care may be available or feel available for patients. So they may be discouraged that after booking a general appointment, they might not actually be able to get what they're looking for virtually, and people may want to discuss issues with contraception, where they would come into an office for, LARC removal or STI testing, and it might not be part of sort of they might not be able to have their entire usual sexual and reproductive health visit that they're used to, right? So they can talk about contraception, but they might not also be able to get their STI testing in that same visit like they may be used to. And another issue that I will end my portion with is the feeling of whether or not shared decision-making for contraception works via telemedicine. So all of these options can be discussed, but access is not equal. So, it's different if someone needs a prescription or if someone needs to come into an office for a LARC insertion or get either self-injection education or come in regularly for depot shots. Barrier methods may be less accessible or may need to be accessed in a new way, such as mail delivery. And there could be some confusion about when someone can have an appointment via telehealth and when they need to come into the office. There's also some challenges with decision-making aids. So I'm happy that folks have covered that in some of the other presentations, but some of that virtual health literacy, making sure that folks are understanding all of their different options, may be more challenging virtually if folks can't show an example of an IUD insertion or let folks see models of different types of care. So with that, I'm going to mute myself and hand it over to Jay.
Thanks, Joe and Angelique. So I'm Jay. I'm going to be talking about identity-based experiences. And so I think that, what Angelique is talking about is kind of these concerns across the board. And I think it's really important to also think about certain identities or certain communities that have even more barriers to care because of their identities and their communities that they're involved in. And so, telehealth, as we all been saying, is a really important part of our healthcare right now because of the way the world is. But if telehealth is done, without a lens of equity, we know that it will widen the gap of access to healthcare and ultimately lead to health disparities for certain communities. So it's a really important thing. But also, if we're not thinking about telehealth with a lens of equity, if we're not thinking about all these communities and all the ways that it can cause harm, then it will widen that gap. And then I think, as I'm going to be talking about various different identities and communities, but I wanted to also point out that you can't just think about one identity. If you know that you have a patient that holds one identity, you may not know other identities that they may hold as well. It's not always evident that a patient holds a certain identity. And so think about all of these things, even when you don't know that your patient is a part of that community or holds that identity. And patients may not feel comfortable sharing those identities with you. So you may not know that your patient is trans, or you may not know that your patient is a part of a community that you're not aware of just because you can't see it on their face and they may not feel comfortable showing that to you. And then we also know that many of these identities intersect. So many people have various identities and intersecting identities. And so we can't just think about one at a time. We have to kind of think about all of them at all the time for every patient. So start off with teens and young people as an identity, or that we've all had at some point in our lives. Teens may not feel comfortable sharing their needs or concerns with members of their household nearby. Teens may be shy to talk about certain things, but there may also be strict rules in their house around sexual activity, and there may be severe consequences to a teen or young person being sexually active. And so they may not feel comfortable, they may not be safe to share their needs or concerns around contraceptive with other people in their house nearby. Or they just may feel shame or embarrassment, even if their family or roommates are supportive of them as a person, supportive of their sexual activity. They just may feel shame or embarrassment to be talking about a stranger over video, where there's not that kind of trust or rapport that you can build over video. So thinking about, is there a possibility of a chat function, like kind of Angelique was talking about earlier? But I think for teens and young people, this is even more of a thing to think about, because we know, teens are on their Snapchat or on whatever other platforms that maybe chat functions are more accessible to teens and young people. And then, so the next category is LGBTQ individuals. I think some particular concerns is that the folks of that community may not feel comfortable or safe to out themselves with other people in their home nearby. So outing themselves maybe about their gender identity, outing themselves about their sexuality, or about their HIV/AIDS status, and just other people in their home may not be aware of those things. Or even if they are aware, it may not be comfortable. I'll give myself for an example. My family is very supportive of who I am and my gender identity. And my mom was helping me with my son to kind of provide childcare for me. And I had a telehealth appointment. And even though she's supportive and knows about my identity, I felt not as comfortable sharing my sexuality or who I'm having sex with over the phone with the provider when my mom's in the other room. So I think just even though I felt safe doing that, it may not be as comfortable for people to do that with other people in their home nearby that may not be usually at their care appointments with them. And then just thinking about, for LGBTQ individuals, I think there's an increased mental health challenges due, particularly right now, to social distancing. LGBTQ individuals, they have their family of choice. They're really important communities to be a part of and have that social connection with. And right now, because of social distancing, they may not be able to do that as much. And so there's just may be increased mental health challenges to consider and think about, where that individual may not be as present for the meeting with you because they have other things going on in their lives. And then communities of color is the next community that I'd like to talk about. We know that people of color are accessing telehealth at a much lower rate. That's something we already know. There's data on that, and that's for various reasons, right? Maybe it's access to technology, maybe it's access to high-speed internet that is not evenly distributed across race, but there's lots of other reasons why folks are not accessing telehealth at the same rate as white individuals. And then other things to think about, right? There's other cultural norms, including that for some communities, women are not allowed to be on video, or maybe not allowed to be on if there's not a man in the room. And so just kind of thinking about other cultural norms that may be in place for communities of color that you may not think about if you're not a part of that community. And then, implicit bias is something that I think always comes up. And I believe later on after lunch session, they'll be talking about this in more detail when they talk about equity, justice, and contraceptive care. But I think just kind of thinking about it, in that there's always implicit bias for all providers, but I think maybe over telehealth, that can be even more so. I think that for people of color, like oftentimes their symptoms or their needs or their cares are minimized or not believed. And so I think over the video or over the phone, that can be even exacerbated even more. For example, if a patient said, oh, my arm hurts me, in the office, you can take a look at that arm and kind of see for sure if what's happening, but there's even a bigger chance of not believing or using that implicit bias that you have over the phone or minimizing those concerns. And another concern for communities of color is that this is, again, we have lots of statistics on this, that providers are quicker to call DCF on families of color. And I think even more so when you're in that person's home. Now you're on video, you can see their background, you can see maybe their house is messy, you can see kind of what's going on. You're no longer kind of, are they in your office? You are right in their home with them. And so I think there's a fear that providers may be quicker to call DCF if they see their home. And so it may not be valid. Maybe, that your provider won't actually call, but just that fear that DCF may be called on them from a long history of that happening, may not have the patient feel as comfortable sharing their needs and concerns. And then, non-English speakers, right? Many of our providers are quick to kind of have interpreters available on the line, but in access to telehealth, right? Are the instructions for accessing your platform available in multiple languages? Or if they call an automated system or get an automated response, is that in English only? I'm not a patient, a provider, I'm an attorney, but we have to call into the court for our remote court hearings. And I had a client who was a non-English speaker, and I talked her through with an interpreter how to get onto the Zoom. She knew the code and everything, but when she called in, it said, okay, enter the code, but it was in English. So she didn't know she had to enter it right now, right? And so even if all the instructions are kind of thought through and okay, my patient's ready, but then they get onto the automated system and maybe that's all in English. And so kind of thinking through every step of the way, are all of those in an accessible language to my patient? And then individuals with disabilities, you know, again, making sure the instructions for accessing your platform are accessible. You know, maybe your patient is blind or other disabilities that a patient might have. You know, are the instructions, is the platform itself accessible? Are the instructions accessible? Making sure that whatever platform you're using is accessible to them, because it's not as simple as just coming to your office anymore. And then, you know, making sure your platform can utilize closed captioning if possible. That is helpful for many people, not just deaf or hard of hearing communities. That is really helpful for people that are just kind of have a lot going on. Maybe there's kids running around, and I think that's something that can really be used in many different circumstances. But I think even more so for folks who are deaf or hard of hearing or have other disabilities that make it harder for them to kind of understand or read lips or that sort of thing. And so having those closed captioning is really important. And then, you know, I'm sure there are other various assistive technologies that I'm not aware of, or that there are other technologies available out there. And so just kind of getting comfortable with what options does your platform that you're using provide, and or can provide a certain option. How can you get that available? And just kind of making sure that you're aware of all of those things, so that when a patient does come to you, you're not scrambling at the last minute to find something that's going to meet their needs. That you already know what's out there, so you can say, okay, I know that I can get, you know, maybe cart services, or I can have this specific relay thing, whatever you know that's out there, so that when you have a patient in front of you, you know what to do and where to go. And then the last category I'll speak about is domestic or intimate partner violence survivors. This one is particularly important to me, as this is the work that I do in my daily life. And so I think, you know, knowing that patients may not be able to give you an honest answer. So even if you're saying, you know, I'm on the call, you're saying, you know, do you feel safe to answer my questions? Are you in a safe place? Are you in a confidential place? They may have to say yes, even though that's not true. So, you know, just kind of making sure you're looking at, you know, body language and other things besides just kind of what the person is telling you, because even though they may say, yes, I'm safe, they may not actually, even that question may not be accurate. And so then, you know, patient safety, like, you know, I think Angelique was talking about a private space, but I think for intimate partner survivors, that's even more of a really important concern to think about. Because even, you know, if their partner's not at home, even if they have a private space and they're alone in the house, maybe they may be worried about their partner recording them over video or other means. Like abusers are really smart and can do things that they may not know about. Maybe there's like a, you know, hidden video camera somewhere. So I think survivors are really aware of these things and kind of hyper vigilant to kind of knowing what may be happening, even if nobody's home with them. So they may not be free to talk about their harm, or even if, again, if the partner is not home, they may not feel that they can talk about the harm that's being caused to them in a safe and comfortable way. And they may not be safe to talk about contraceptives, or whether or not their partner is there. If their partner is there, talking about contraceptive use may not be something that's safe for them. Maybe the other partner doesn't know that they're using contraceptive, and they may not be safe to talk about that specifically. And then kind of thinking about, does your platform have a fast way to exit the call or hide web history if the partner does come home, right? So is there a quick way, can they just click an X to get out of the platform if they need to? Or is it a multi-step process? They have to click the X and then click yes, confirm to leave the meeting. And is there a quick way to hide the web history? Can they click one button to erase the web history so that their abuser doesn't check it out and see what they've been doing and be able to know what they've been doing, who they've been talking to? And then just thinking, you know, even if none of these things are in place, maybe even if they are safe, if everything's fine, and just knowing that the overall environment at home is stressful, and so a patient may not be fully present with you in that moment on that video call, even if they, you know, they're safe in their home at the time, just because, you know, survivors are have experienced a lot of trauma, and so kind of they're, you know, like I said, they're hyper vigilant. There's other things going on, and they may not be talking to you on the phone, talking about their concerns, but their health may not be their first concern to think about in that moment.
Awesome. Thank you, Jay. So just some of our main takeaways summarizing, and then we'll move into questions. So the biggest piece that we wanted to share is that all of these categories, all of these things that we have talked about today intersect. Right? So there might be a young person who also has challenges with that, that confidential space piece that we talked about, and also be looking for a chat function. And there might also be someone who is LGBTQ and a survivor of domestic violence or intimate partner violence, and navigating that while needing to access contraceptive care. Right, so all of these, both the care experiences and the identities may be overlapping. We want folks to be able to recognize some of these possible inequities, We always encourage listening to patient experience, but especially when, rolling out a new type of care delivery, it's especially important. And being able to prioritize that patient care and to be creative, right? So I've already seen that folks in the chat are sort of sharing some different things. As we mentioned, right, that chat function, or is there a way that people can exit out of the meeting, the telehealth appointment, right? We're really encouraging folks to be creative, be open to feedback, and finding new ways to improve care as we are in this new world of telehealth. And with that, we'd love to move into questions.
Thank you all so much. You gave us so much to think about, both as we provide care, but also if telemedicine is here to stay and expand, how we are going to improve the platforms that we use in the technology. So you are right, we are getting questions. So our first is, how do you all, and obviously each patient's different, but how do you feel about being called early for a telemedicine appointment? Sometimes providers do have time in their schedule, or they finish their last appointment a little early, and they're just not sure if they should call or wait for the appointment time.
So I think this comes back to that communication piece in advance, right? So if patients know they may be getting a call a little bit before their appointment time, I know that's a common experience maybe for an intake, right? So for a medical assistant to do an appointment intake before meeting with a provider. So as long as a patient knows, expect a call 15 minutes beforehand, and maybe frame it. Oh, you might come to an appointment 15 minutes early to fill out an intake form. We do the same thing via telehealth. It's just in a little bit of a different format. Communicating that out to patients in advance it is the way to go.
Great. We have another question. Have you heard about specific things providers have done or could do to make a more warm personal connection via telemedicine?
I can just provide one example, I think, from what my provider did, was that, when she called me, when the video started, she didn't just jump in right to the appointment. She said, "How are you doing? What's going on?" I know we have a prior relationship. She asked about my son, and she asked about kind of what's going on. Just kind of even that 2-3 minutes of just like connection person to person helps the appointment go forward. I think especially if there's no prior connection, I know prior trust built with the provider, just kind of having that few minutes at the beginning just to say, person to person, how are you? What's going on? What are you doing? We're all having a hard time right now. How are you coping? Is a really kind of good first point to kind of have that foundation.
I want to piggyback on what Jay just mentioned, that having that first 2 minutes be just a social call tends to be very helpful. A lot of us are going through a tough time right now. So even taking those few minutes to say that you care, is there anything that we can do to help you for having a tough time right now? Are there any referrals or resources that might be helpful? I find tends to make a big difference instead of jumping right into the appointment.
And also making some sort of personal space, right? A lot of us have spent time, now that this is our new normal, to create a workspace at home. And for many of us, that's some sort of neutral background. But there's also the ability for providers to craft their space just like they might an exam room, right? Is there something special that is important to them that says something about them or about the way that they deliver care that they can include in their virtual exam room?
That's a great idea. After COVID, the healthcare system is going to need to make some choices about which services to continue via telemedicine and which to start providing in person or an option for the patient. Do you have any reminders or ideas for the providers and administrators on this call who make those decisions, what they should be keeping in mind when they're kind of deciding how appointments will be held?
I think you said it, Natasha, was that piece about the option. I know that might make it more difficult for scheduling, but I also understand that people are kind of evolving through this pandemic and this experience in really different ways. And for some people, it may feel like their life has somewhat returned to normal. And then there's other folks who, this is still a very big part of their reality of working from home, caring for multiple generations, as Joe mentioned earlier. So that flexibility in being able to access care remotely or in person, I think is going to be a key piece of moving forward with telehealth.
Thank you. I know you have a final thought, so I want to leave a minute for that, but just in case people aren't monitoring the chat, I want to highlight a couple comments that have been made. One is that encouraging the use of headphones can be helpful for privacy and confidentiality, and also asking kind of what their 360 room is like, what's in the room with them. And then also thinking about, when thinking about starting a call early, it's not just about provider availability, but also patient availability. So that check-in is really important. And to be mindful of time, I'm going to hand it back to all of you for your final thought.
Thanks, Natasha. All right, so our final thought, approaching contraceptive care with equity in mind is really critical as our country and our healthcare landscape continue to change, shift, and bring persistent inequities with them. So you all as providers have a unique opportunity to integrate patient needs into the new ways you deliver care. Thank you.